Good morning. I'm Anna Marie, and it's time again for Focus. It's a closer look at people, places, and things right here in our own backyard. And today we're going to talk about one that is a gem. It's Second Harvest Food Bank of Middle Tennessee. And to give us all the details, please introduce yourself to our listeners. Tell them who you are and what you do.
My name is Amy Causey. I'm the Senior Manager of Innovation and Programs at Second Harvest Food Bank of Middle Tennessee.
What does that mean that you do at Second Harvest?
So my team oversees all of our program sites. So we've got so many programs at Second Harvest that really meet people where they are and work with folks from all walks of life. We've got children's feeding programs. We've got senior nutrition programs. We've got neighbor care pantries, mobile programs like the mobile market and the mobile pantry program, as well as home delivery. And then the other set of programs that we have is nutrition and healthcare programs.
Okay. Let's go a little more in depth into that first set of programs you were talking about.
Yeah, so our children's feeding programs.
Yeah.
So these are ensuring that kiddos across our service area are nourished. So for folks that may not know, 1 in 6 children in our service area are food insecure. And in total, we've got 400,000 plus people food insecure in our service area, meaning they don't know where their next meal is going to be coming from.
Really? That just
Yes.
seems, when you hear those numbers, that just seems outrageous because we take it so for granted that we can go get something out of the fridge, we can stop and pick something up on the way home, but they don't know where their next meal is coming from. What would be underlying causes for this?
So many reasons. So oftentimes it's economic, right? So in Davidson County, we're really urban. And what we tend to see is food insecurity is caused by the economy. It's caused by lack of funds to buy food, but it's also just a lack of general resources where, if you have to pay for rent, if you have to pay for transportation, all of these things, less money is funneling into your food budget. And so you may need some extra help at the end.
Mm-hmm.
But, we cover 46 counties throughout Middle and West Tennessee. So Davidson County is food insecurity in Davidson County is very different than what it would look like in our Western Territory or even in our surrounding donut counties. Oftentimes these counties are much more rural. And so food insecurity is, yes, an economic issue, but it's also an access issue because oftentimes you're not going to have grocery stores for miles and miles away.
Mm-hmm. And you won't have transportation to get that far if you need it.
Correct. Or transportation resources as well.
So how does it look in Davidson County? You say it's different from in Davidson County compared to what is food insecurity? What does that look like in Davidson?
So with Davidson, luckily we are very well resourced, right? So it's not a resource issue. It could be a resource accessibility issue, but it's more so people, gentrification is happening. Places where folks used to live, they're now way too expensive for them to afford. And so they're getting pushed out into counties like Rutherford County or Sumner County. And so, Nashville is becoming very affluent, but there are still pockets of poverty that we're seeing. It's just what Nashville looked like 5 years ago is very different than what it looks like today.
Does it tend to create people who are older who are food insecure, or is it just across the board age-wise?
Across the board. Anybody can be food insecure. 1 in 8 people experience food insecurity currently within our service area. And again, it's over 400,000 individuals. And food insecurity can hit you at any point in your life. So you could, college students, for example, you're going through college, you're getting an education, you're paying tuition. It's really expensive. So
Yeah.
you may experience food insecurity at some point. We've got hospital pantries right now specifically for patients that may be experiencing food insecurity. Our children's feeding programs are especially tailored to nourish the body of children that are struggling with food insecurity. So there's no single face of somebody who's food insecure. It really could be just across the board and at any point in life.
Do you find that there are some groups or age groups that find it more difficult to come forward and ask for help?
I think probably seniors more so because they oftentimes don't have the resources to get the help they need. Some of them may be homebound. Some of them may have issues with, knowing how to use technology. And we're moving in a very technology forward direction as a society.
Yeah.
And so there there's a lot of catching up that folks have to do. And although technology is really wonderful, it can also pose a lot of barriers for our seniors.
And there are families who had internet, and so there will be families who don't have access to that technology.
Exactly. And technology is essential, which we know.
Yes. Okay. And now, were some of the other programs that you mentioned besides for the children?
Sure. So I'll talk about the mobile programs because we touched on transportation a little bit.
Yes.
Yes. So most recently in October of 2023, we started our mobile market program, which is designed to provide equitable access to nutritious foods in areas that are food deserts or in areas that are high poverty. And so we go directly into communities with the help of a community ambassador. And think of it like an outdoor farmers market. So we set up tables outside in a neighborhood. Folks are able to come through, pick whatever foods they want, need, and prefer. And what's even better about this program, like I said earlier, like Davidson is very well resourced, right? But oftentimes it's a connectivity issue. So although we have all these resources, if somebody doesn't know about them, what good are those resources doing?
Right.
So this program is really focused on collective impact and ensuring we're making those resources accessible to the community. And so we work with various nonprofit organizations across our service area and bring them with us while we're distributing food. They're providing their services.
Oh, like what? Like who?
So Tennessee Justice Center is a great example. They do a lot of TennCare assistance and WIC and SNAP troubleshooting if somebody's having those any application issues with those
And
programs.
those programs are
So Tennessee Justice Center is a nonprofit, and then those are federal programs that I just mentioned.
the WIC and SNAP
WIC
are
and SNAP. They're federal nutrition programs.
okay.
And then Nashville Diaper Connection, they provide diapers to folks that need them because diapers are very expensive. And I believe
Yes.
I don't know the exact dollar amount, and I will probably be wrong, but I think it's like $90 a month that a family has to spend on diapers, which is crazy to me.
Yeah, sure it is.
Probably more, depending on if you need an allergen-friendly one or whatever. So
Oh, right.
always have to think about that. We also work with a couple of healthcare wraparounds, so they'll provide vaccines on site or wellness checkups. We've been working with legal aid, so making sure that our neighbors have accessibility to legal resources, especially surrounding housing and evictions and whatnot. That's really important.
Especially because if they're having trouble buying food, they're possibly having trouble paying other bills and keeping a roof over
Exactly.
them. So you said with the help of a community ambassador?
Community ambassador. So something that we're well aware of is we are outsiders to a lot of the communities we're going in. And so we want to be very intentional with how we approach our neighbors in those communities. So oftentimes the community ambassador is going to be somebody from the community that is going to help us distribute food, help get the neighbors well acquainted with us, and then, probably be a little bit more hands off later on down the road, just so we can start building that relationship and rapport with our neighbors.
Is that possibly like a community leader or a church leader or what kind of person can be?
All of the above, all of the above. If you know the community members and if you are from that community, you could be a community ambassador.
Does that sometimes include translation?
Yes.
Is that important?
Yeah, so we go to two very culturally diverse sites on our roster right now, and none of us speak Spanish or speak other languages that are there helping out at the distribution, but that is okay because we have these wonderful community partners like Conexion Americas and Tennessee Immigrant and Refugee Rights Coalition that have translators on site. And if somebody speaks Arabic or they speak Spanish or Kurdish or whatever it may be, there's not going to be a language barrier for folks accessing food.
So they still can get help.
Exactly, which is the most important thing.
And so not only accessing food, but accessing help and services from the other partners that you guys have there.
Correct. So not only are there translation services and they're getting this incredible, nutritious, culturally responsive foods, they're also becoming aware of other services that exist should they ever need them.
And I like that you said culturally aware,
Responsive.
culturally responsive food. So that means it's not going to just be tuna and macaroni and cheese for everybody.
Exactly. We all eat so differently, right? Food is very personal.
It is, and memories. And
Yes.
Yeah.
Absolutely. It's very personal. We eat food based off of various health reasons or how we grew up eating. And so, and also where we're from, right?
Right.
So we want to be very intentional when we're going to a mobile market. If we see that one stop is not taking sweet potatoes, it's probably because one, they don't know what sweet potatoes are. And
Yep.
two, there are other varieties of foods they probably prefer. And so instead of us just making that observation and bringing sweet potatoes next time, we want to ask a few questions, see what foods are going to work for them, and ensure that we are taking action steps to make it a more culturally responsive next mobile market distribution.
Mobile market distribution. I think that's just brilliant. And you started it just last year.
Yeah, October of 2023. And since that time, I think we've distributed over 300,000 pounds of nutritious foods, which is incredible. Every distribution, we are bringing thousands of pounds of fresh, nutritious produce to these communities. And what's even better is that we're visiting them on a regular basis, because I did say, you know, these are food deserts, these are areas of high poverty. And so we don't just want to come every other month or once every 6 months. So we're going to come twice a month or once a month so folks know when to expect us.
So would you explain to people what food deserts are and why high poverty areas specifically need this as well?
So food deserts are areas where for miles and miles there may not be a food source. Oftentimes you may even hear the term food swamp. So there are some areas that, yes, they don't have a grocery store, but there are a lot of fast food establishments. So that is considered a food swamp.
Oh.
And then areas that are high poverty, there is that intersection of hunger and health. So we know that a lot of folks that are experiencing food insecurity, if they don't have access to the nutritious foods that they need to thrive, then they're not going to thrive. And it's, you know, not going to create a community where health equity is achieved. And so we are very, very intentional about this program and ensure that we are being equitable with our approach and serving areas that have historically been underserved.
And you mentioned the health equity. What is that, and why are we striving for that? And why Second Harvest Food Bank specifically?
So when you think about anyone, right? We really cannot thrive unless we are healthy. Our health matters so much, and there is so much that goes into health, right? There are the various social determinants of health, and if we're thinking about only food, and we're not viewing the whole person, we're not taking health equity into consideration. And so all the wraparound partners I mentioned earlier, they help us look at the whole person, ensuring that, yes, we are providing the culturally responsive, nutritious foods to our neighbors. And we're co-creating with other organizations that are experts in their own niches to work on the other determinants of health. So when we're working with Tennessee Justice Center, they're addressing the health access issue. When we're working with Nashville Diaper Connection, they're helping out with the resource issue. And so it's all of us coming together to really help somebody and create an environment that is more equitable, which historically has not been.
Okay, so that's one of the new things that Second Harvest Food Bank has added. What are some of the other programs and ways that you meet the needs of the community?
So one other new program, it's another mobile program, but it's our rural home delivery program. And so
That's wonderful.
it is wonderful. So initially when I was talking, we were talking about how in rural areas, food insecurity is oftentimes an access issue.
Yeah.
So our goal with this is leveraging our partner agency network in rural areas to deliver food to our neighbors in those areas. So we financially support them. We provide them with the food that they need, and all they have to do, because they have this relationship with their neighbors, they know their neighbors the best, is simply just deliver that food.
Who would be that person to make the delivery? Is it a business? Is it an individual?
So in our rural areas, because those are lacking resources, we try and work with the volunteers of the partner agencies. So yes, volunteers or partner agency leaders.
Okay. And you said you provide the funding?
We do. So any gas mileage reimbursement, anything like that, we want to ensure that the volunteers are supported and food costs are supported as well.
So Second Harvest Food Bank provides a whole lot more than just here's your little box. Your goal seems to be to help the entire person.
Absolutely. Absolutely. And it's all about supporting the partners that we're working with as well. We are experts in food distribution and food sourcing and really so many things. And all the folks that are doing this incredible work with us, our 600 partners across our 46 county service area, we want to ensure that they're able to do this work for a long time and that they have all the resources they need from us to feel supported and continue doing that great work.
Okay, so then you were moving on to the nutrition side of things.
Correct.
And
yes.
I interrupted you, but I was
No,
so
you're
excited
good.
about the new programs. I'm like, wait, what? Home delivery?
Yes. So we have 2 other programs. I'll put them in the umbrella of nutrition. And so it's the nutrition outreach program and then our healthcare program.
Okay.
So nutrition outreach, so we distributed 42 million pounds of food last year. 13 million plus of those pounds were fresh produce. Now we can source produce all day, every day, but when we get interesting produce items like a bok choy or a kabocha squash, and we give them to a neighbor that historically may not have ever had access to that or has ever seen that, they may not know what to do with it. They probably will not know what to do with it.
Right.
And, one of many things could happen. Yes, they could be adventurous and eat it, or 2, they could throw it away, or 3, they may never use it and it will eventually end up in the trash can. So my team consists of 2 registered dietitians, so myself and another registered dietitian, plus an army of dietetic interns that are studying to be registered dietitians. So these individuals will put together recipes that are poverty conscious, meaning we're not doing anything crazy and out of a normal individual's budget. For
You'll need butter and heavy cream for this one.
Exactly.
Yeah.
We want to be very poverty conscious with our efforts, use ingredients that many folks have on hand that are inexpensive. And they'll create these wonderful recipes for the sake of teaching folks how to use the foods that they're getting. And then not only just using the foods, but say somebody does receive 30 things of squash, right? Which could happen. What are ways you can preserve that squash and use it for later?
Oh, that seems like that would be helpful for everyone.
Absolutely, it is.
So do you have recipe books and recipe info for the general public online?
We are planning on adding those. So we recently created a lot of produce cards, pretty much on any produce item that we've historically ever gotten into the food bank. And it highlights nutrition education, just nutrition information on that produce item. So, for example, a carrot, like, oh, these are high in vitamin C and good for your eyes, or vitamin A and good for your eyes. And this is a recipe that you can make, and this is how you store it, and this is how you prepare it. So all of that information is on one card. So if we do end up getting a bunch of pomegranates one day, which could absolutely happen, and they're great if you know how to eat them, we can also send those recipe cards or produce cards along with them.
That is wonderful. So education.
There are cooking classes, which is great. And then also just general nutrition education, right? Just health nutrition education. So chronic disease prevention.
Like what?
So for example, how to eat healthy if you have diabetes, but you're living in poverty.
How would you? What would some ideas be?
So what we like to do is we like to put ourselves in the neighbor's shoes, and oftentimes these neighbors may just have access to a food pantry, or they may have access to only a convenience store, and oftentimes healthy eating is perceived as something that's very expensive, and my team works really hard to make sure that folks know that healthy eating is not expensive, and the food bank provides a bunch of nutritious resources and foods to food pantries so that no matter who the neighbor is, they can get the foods they need to thrive and live their life to their full potential, and take care of their health.
Why is that such an important part of Second Harvest Food Bank's mission? To keep people healthy?
Because at the end of the day, if we are not healthy, we cannot thrive, we cannot reach our full potential, and it all ties back to health equity.
And for our entire community.
Absolutely.
If part of our community is suffering, or some of our neighbors, as you say it. if somebody just wants to find out about a Second Harvest Food Bank mobile visit or a location where they can pick up food, where do they go?
So you can go to our website. We have the Find Food tool there. And so you can enter your zip code, and all the partner agencies in your zip code will come up in addition to hours of operation, and you can get directions on there. It's really great. Or for mobile pantries, which are large scale mobile distributions where folks get a ton of food that goes in the back of their car. It's a drive-through mobile distribution. That schedule is also put on there per county.
Mm-hmm. So all the partner agencies, those are agencies that depend on Second Harvest Food Bank for the food that they distribute to their clients.
Correct. So
the people they help.
Yes, they are our partners across our 46 counties that have the relationship with the neighbors, and they receive their food from us.
So maybe they started serving a niche of specific people. We're serving this group.
Correct.
But in addition to the things that we bring to them and the resources we bring to them, they need food.
Correct.
So now we bring in Second Harvest Food Bank's food and distribute that to them.
Yes, and these can be churches, they can be various other nonprofits. Our partner agencies are amazing. They're doing really great work, and we're so grateful to serve alongside them.
You collect the food,
Mm-hmm.
you get the food ready to go out, you choose where it's going, who it's going to, what kind of package to put it in. There are a lot of hands that touch all this food and lovingly help get it ready, prepared, and out into the hands of somebody who needs it.
Mm-hmm.
And so that's like, it could be, 2 or 3 agencies deep?
I would say many hands. I wish I had an exact number, but so many hands thoughtfully and caringly touch that food and then finally deliver that to the neighbor in need.
Mm-hmm. Are there other groups age-wise that you prepare food for? Because you mentioned the children, that you give them nutritious food for their young bodies. Is that different from food for older people?
Absolutely. So when we think about, food for older people, we have to think about what are our seniors going to be able to eat. So oftentimes they lack dentition.
Their teeth?
Yes, their teeth. So they may have actual dentures, or they may not have the best teeth. And so, we would never send an apple to them, right? Mm-hmm. We would want to send them applesauce. And also, as you get older, your taste buds change. And so seniors may like things that are a little bit more salty. So all of those things we keep in consideration versus our kiddos who love snacks and love mac and cheese. And we try and source the healthiest form of that. So items that are low sodium and low saturated fat, because at the end of the day, nutrition is at the forefront of the things that we do.
Yes, rather than just putting some food into their hands.
Correct.
It has to be nutritious.
Correct.
Food. So kids' diets would be different than older people's diets. What about folks in middle age, just kind of people in the middle? Is it just varied depending on?
I think it varies. And, as you grow older and you go through life, you develop various different food habits and food preferences. And you may have a chronic disease that comes up at some point, which sadly is very prevalent, right? So you would have to change your food habits based off of that. So it evolves throughout the lifetime. But something that we know is that kids and seniors, they have a very specific diet that we're always trying to cater to.
Is there something specifically for people who have like some sort like chronic health issues?
Yeah, so we we have a 9-year partnership with LifePoint Health. They are incredible and have provided us with the resources to create disease management boxes.
What?
Disease management boxes.
That's beautiful.
It's really great, and the boxes are fabulous. So we have 2 different disease states that these boxes cater to. We've got hypertension and we've got diabetes. And so in each of those boxes, you've got nutritious items that you could easily find at not a healthcare pantry, but a food pantry in general. And so, again, we're meeting people where they are. We're trying to be poverty conscious with our efforts. And so those boxes, if somebody is newly diagnosed with diabetes or they have prediabetes, they can get this box and they can see, oh, there are healthy options available at food pantries. And this is an example of foods that would work for me.
Right.
In every box comes a nutrition education card, which has nutrition education information on it, but there's also a QR code that folks can scan, and it takes them to our nutrition and recipes page on our website, and it has a bunch of recipes and health information. It's really great. And then in addition to those boxes, we also have these diabetes tray packs, which were developed by our registered dietitian and PhD level food scientist. And so these are great for anybody with diabetes. The carb count is super low. The meals taste really, really great. So it's not like you're getting a healthy meal and it's sacrificing all of the flavor.
Oh, wow. Now, I know this is kind of a selfish question, but is it possible for just the general public? Like my husband has high blood pressure, and so we work with a low sodium diet. But you just gave me hope that there's possibly a place for me to get a lot of recipes and find foods that I can use to help his diet be better.
Yeah, and one, the internet is wonderful, right? Dr. Google, we've all got that. But Second Harvest, we have a bunch of nutrition information recipes on our webpage. And
Can anybody go to it?
Anybody can go to it. It is accessible to the public. And, what's good about these recipes is, yes, they are budget friendly, but they also taste good and they're really nutritious.
Beautiful. Is there anything else that you'd like to make sure that people know about Second Harvest Food Bank, new programs, new campaigns, new initiatives, things that are around the corner that we can look out for and maybe help?
We are going to be starting our Power of One campaign, and that is going to go until the end of September. And it, is a testament of how one small action, whether it's coming to volunteer at the food bank or donating a couple of dollars to the food bank, whatever that one action may be to help a neighbor that is struggling with food insecurity, how in the long run, all those small actions put together will lead to really, really big, incredible change. And so some of the ways that folks can get involved with the food bank are, one, by coming to donate their time and volunteer and physically touch and package the boxes and the backpacks that are going to be going out to our neighbors in need. They can donate funds to us, and so there's no such thing as a donation that's too small, because every dollar donated provides 4 nutritious meals to a neighbor in need. And again, there are over 400,000 food insecure individuals across our service area. So really, no donation is too small. And then also host a food drive. We are always looking for an assortment of foods. And this is one of the ways that our partner agencies can get food is through these food drives. So plant-based proteins like peanut butter and beans are great. Rice is wonderful. As well as canned chicken and canned tuna.
Oh, yes. And so what does it take to host a food drive? Is it a business? Is it an individual? What do you need?
It can be anybody. And we've got boxes at the food bank that you can bring to your establishment, market that you're doing a food drive at your organization, and just bring the food to Second Harvest.
Now, you said backpacks. What are the backpacks? Is that how the children get their nutrition?
So that is one of our children's feeding programs. So we've got 3. We've got kids cafes, school pantries, and backpacks. And backpacks are little Ziploc baggies with a bunch of non-perishable, nutritious foods that you can easily and discreetly slip into a child's backpack. So if a child is struggling with food insecurity, they have some nourishment over the weekend.
Oh, my goodness. And then the other that you said was what?
School pantries. So these are pantries within schools. We have 50 school pantries right now across our service area. And so these are great for the family as well as the child. And then we have kids cafes as well, which is an after-school feeding program, but there is a nutrition education component to that as well.
And so it's called Kids Cafe, so there's no stigma to it.
Correct.
When somebody comes to Second Harvest Food Bank, do they need to prove their income?
No.
You guys are wonderful. We're so happy to get you back. Thank you for coming back and talking with us again and letting us know what Second Harvest Food Bank is up to.
Thank you for having us.
Thank you. And you can find out more about Second Harvest Food Bank of Middle Tennessee. We've got links posted here with the podcast. Make sure you join us again next week. I'm Anna Marie, and that's Focus.